Welcome to Purrception. Imagine coming home after a relaxing vacation. You open the door, but instead of a warm greeting from your cat, you find urine on your pillow, or a shredded houseplant. In that moment, we take it personally. We think, she's angry because I left. She's getting revenge. That tendency has a name: anthropomorphism, the projection of human moral concepts and complex emotions like revenge onto our animals. But is your cat actually capable of revenge? Today, in our Purrception series, we look at what science says and why the concept of revenge simply has no place in the feline brain. To understand this behavior, we need to look at neurobiology. The cat's emotional control center is the amygdala. It processes stimuli in milliseconds, and at any perceived threat, it triggers a hormonal cascade of adrenaline and cortisol. Equally central is the seeking system, a motivational circuit hardwired to scan for resources. What cats lack, however, is the complex theory of mind required for revenge planning. Revenge demands future planning, the ability to premeditate actions far in advance in order to redress a moral wrong. The feline brain is simply not built for that. And one more thing, cats are mesopredators. That means they are simultaneously hunters and prey. Their system is calibrated for safety and immediate stress responses. When they act out, it's to reclaim a lost sense of control. Let's look at scenario A, urination on the bed after a vacation. We tend to read this as protest, but research identifies a correlation between owner neuroticism and so-called sickness behaviors in cats. An unpredictable or authoritarian interaction style, combined with human stress, transfers directly to the animal. Studies document a correlation between the owner's stress level and physiological stress markers in the cat. House soiling here is not an act of revenge. It is a physiological consequence of chronic anxiety and the loss of territorial security. Scenario B, scratching or pawing near the food bowl. This is a classic vacuum activity, a fixed action pattern. In the wild, cats bury food remains to avoid attracting predators. During the pawing motion, they also deposit pheromones via their interdigital glands. They are marking the location as occupied or safe, maintaining social distance in a stressful environment. When we remove the revenge label, the real biological triggers become visible. First, medical factors. Chronic stress frequently leads to a painful condition called feline idiopathic cystitis. Dental pain caused by FORL or hyperthyroidism can also produce dramatic behavioral changes. Second, acoustic stress. Cats can hear frequencies up to 64 kHz. Critically, low-frequency sounds below 150 Hz are instinctively associated with large predators and existential danger. Research on feline audiogenic reflex seizures documents that high-frequency sounds, including mobile phones and medical devices, have been identified as triggers in older cats. This finding has been documented in the veterinary literature since 2015. Behavior. Audiological studies confirm that sound pressure exceeding 120 dB produces a physiological pain response in the feline inner ear. Behavioral research examines the effect of aversive stimuli on the quality of the cat-owner bond, and the principles of operant conditioning are clear. Studies on operant conditioning in Felis catus document that aversive stimuli consistently correlate with elevated stress markers and reduced attachment quality. Pessimistic cognitive bias and defensive aggression have been described as measurable downstream effects. What does research identify as an effective path back to trust? Here is a scientifically recognized three-step framework. Area 1. Medical causes. Veterinary medicine documents that in a significant proportion of behavioral cases, the underlying cause is organic, particularly involving the teeth, bladder, and thyroid. Area 2. Predictability. Studies show that puzzle feeders measurably reduce stress-related behavior. They engage the seeking system with targeted stimuli. Research correlates routine stability with measurable reductions in feline cortisol levels. Area 3. The cat framework: choice, attention, touch. Behavioral research shows that cats display measurably lower stress levels when they are able to regulate the duration and intensity of contact themselves. A twitching tail tip is recognized in behavioral research as a physiological correlate of heightened arousal. Research on feline allo-grooming documents that contact in the area of the facial scent glands consistently correlates with lower physiological stress indicators than contact with other body regions. Conditioning studies identify a critical time window between stimulus and reinforcer within which learning effects are most consistently documented. The efficacy of different food stimuli varies individually and remains an area of active research. Your cat is not punishing you. She is under stress or in pain, and she is simply trying to find security in her world again. Behavioral research suggests that a deeper understanding of feline neurobiology influences the perceived quality of the human-animal relationship. Want to learn more about the fascinating language of your mesopredator? Then subscribe to Purrception. Until next time.